Hi, my name is Megan Reynolds, and we're going to be talking about public health care and HIV and AIDS patients and how to treat and prevent the disease. So what AIDS is, it's an acquired immune autodeficiency disorder, and HIV is a human immunodeficiency virus, and both of these came around on June 1st, 1981, when they were both discovered. HIV is an which cause failure to the immune system, making the body more susceptible to infections and cancer. One of these infections is also known as tuberculosis. For some patients, HIV develops into an acquired immunodeficiency syndrome, also known as AIDS. We chose this topic because it has been identified in the U.S. as an issue that was once neglected and has now been making notable accomplishments. The CDC, also known as the Center for Disease Control, has been working with ministries of health to transition HIV and AIDS care and treatment service delivery through to local county ownership in 13 countries. Tuberculosis is the most common opportunistic infection for people living with AIDS and HIV to be a leading cause of death. The Center for Disease Control has expanded testing and counseling to tuberculosis patients, and the center has also worked with the World Health Organization to develop protocols, training, and policies. The center has also created a package called the Basic Care Package that gives high-impact, low-cost interventions that are easy to implement in minimizing the susceptibility of HIV-infected persons. The CDC is working for transition care and treatment programs to local areas and organizations, where the workforce is also making efforts to increase quality of education and numbers of physicians, nurses, pharmacists, and counselors. In 1981, on June 1st, the first reported case of AIDS was found, and in 1982, the disease became more notable and more well-known throughout the United States and around the world, especially in Africa, coming to be known as AIDS. The causative agent was defined in 1984, and soon after, the HIV antibody test was created. It wasn't until 1987 that the first medication came to be.
Okay, so that was Megan talking about our topic and why it is of interest. I'm Erica Dominguez, and I'm going to be explaining the current state of knowledge about our topic, controversies, and how things are going right now. So as you guys can see, as of 2014, the majority of the people who carry HIV do belong to African Americans, and then it follows by the whites, and then follows by Hispanics. So the current state of knowledge of it, starting from 2010 to 2014, the percentage of people living with HIV and who were also aware of their HIV status went from 82.7% to 85%. And then in 2014, 85% of people living with HIV in the US knew of their status, which had exceeded the national HIV/AIDS strategy's annual goal. And if you have been tested negative for the disease, to prevent getting the disease, one would use condoms.
My phone's at like 9%. So I'm gonna have to plug it inside my car.
Okay. I'll get into my car and then I'll just text you.
Okay.
If you are at high risk, you can take these medications daily to lower the risk of getting infected. Using these medications consistently and daily will reduce the risk of getting HIV from 6 to over 90%. There is also another treatment, antiretroviral therapy, which also significantly reduces HIV.
Oh my God. Okay.
So these are just little examples of how you can get HIV and AIDS: sex without a condom, hereditary, sharing injections, and contaminated blood infusions. There are certain controversies that are going on right now about HIV, and one of them is that there has been a report that a small number of Japanese patients, including 1,792 hemophiliacs, have contracted HIV infections from the use of commercially available untreated blood products, which could be injected plasma from other patients to help thicken hemophiliacs' blood, or just contaminated blood transfusions. After the use of this, many of the Japanese patients who used this directly developed AIDS and died shortly after. Then the chief of those biologics at the Ministry of Health and Welfare was arrested for the failure to prevent the spread of HIV throughout that country. And then that's our work site.